Friends, I am Dr. Amdekar. In this episode, I am going to discuss an important issue while we initiate our interaction with the patient while history taking, something that we should never forget, and that is a patient listening is the first step of patient's interaction. What is this listening means? Is it same as hearing? Of course not. Hearing is something that you just capture the words, but when you interpret those words, when you understand what those words mean, it becomes listening, and therefore listening is the interpreted version of what we hear. This is important because medical practice is thought in action, and while we hear the words, we also start interpreting them. We like to find out what those words mean. We look at the patient eye to eye with full concentration. We look at his body language. We look at his tone, what would possibly will convey to us, and each of these factors, when put together, we interpret what is being told to us, and that is what is called as listening. Friends, listening is a very important aspect while we initiate our patient's interaction. And what does it do to really the outcome of our management? Well, when you listen carefully to the patient understands that the doctor is quite concerned with his problems. The doctor is committed to do his best, and that itself starts a tremendous faith of the patient in the doctor, and that is the beginning of setting the tone for a mutual trust and respect. And I think patient listening, therefore, is the important first step. The question always is asked, what happens if you don't listen carefully? Well, you are likely to miss something that is very, very important. And does it happen day to day in medical practice? I feel so. Because the present era, I call it as an era of compressed medicine and a hurried care. What do I mean by compressed medicine? Compressed medicine is everything compressed to go quickly through investigations, modern technology, and try to find answers and not waste time in history taking, in the art of clinical practice, a bedside medicine, thinking, interpreting. Oh, it takes time. Today's technology can possibly make all such mundane issues obsolete. But friend, that is not so. Unless you listen very carefully, you do not really get to come out with an excellent and rational outcome. And you know that the steer concept goes beyond just thinking to make us excellent and rational in our practice. And then what happens with this compressed medicine? That you quickly go through all the tests without thinking, without trying to interpret, without trying to listen to the patient, and the result is a hurried care. What does that mean? Is it harmful? Of course it is. Besides making the patient spend money, time, energy, you also miss important clues to the diagnosis. And in medicine, it is not just that you make a diagnosis somehow at the end of several tests, but the rationality demands that you use your thinking process and minimize your tests and minimize your unnecessary drugs, and that is rationality, and you miss all that if you do not listen properly. Medical practice is the thought in action, and while you hear the patient, you listen, which means you start interpreting the words and you start planning what it means and planning the action thereafter. In my own experience, I have had many occasions where the doctor did not listen and therefore he missed important clues to the diagnosis. I recall a 15-year-old child who was brought to an emergency with a very severe, excruciating abdominal pain. And when the doctor asked him to describe where the site of pain was, he pointed out to the right lumbar region, and he said that the pain is going horizontally across half side of the abdomen. Then when he was asked, what is the kind of pain, type of pain, is it dull ache, is it colicky pain? He said, no, it looks something burning to me. Well, the doctors heard, but doctors did not listen. He was trying to say that the pain is going across the dermatome horizontally, and the type of pain was a burning pain. He was giving a clue that it was a neurogenic pain coming over a single dermatome, and when several blood tests and imaging tests were done, much before the test results arrived, and of course they were negative, the vesicles arrived on the skin and a diagnosis of herpes zoster was made. Friends, what happened? The patient, uneducated, illiterate, was giving a right information, but those words did not mean anything further than mere hearing, and that's the importance of listening. There was another similar patient sent from out of Bombay, and when he visited his doctor in his village, he had some fever and cough, and some chest x-ray was taken, and it showed some shadow, and then, in spite of several drugs and repeated x-rays showing different shadows, the doctors were foxed there, and the patient was sent to the major city for an opinion. When I asked the educated patient, yes, they could possibly tell you something or demand, but this was an uneducated, illiterate father who was quite upset that their doctors were not ready to listen. When I asked him what is wrong with his child in his views, he refused to tell me anything. I asked him, why don't you tell me? He said, the doctors don't listen and they feel they know everything. I promised him I would listen to whatever he said, and he requested me to take an abdominal x-ray and not chest x-ray. I asked him why he feels there is something wrong with the abdomen. He said, in the whole village there is no human being with such a sunken abdomen. He said his child almost has no abdomen at all. Friends, if you listen to him carefully, you got a diagnosis of a diaphragmatic hernia, and when this child, at different times, the different x-rays showed some shadows. At one time, they saw a fluid and air in the chest, and they decided to tap, considering it as a hydropneumothorax, and they got milky fluid. So they started investigating whether this was a chylous, pseudochylous, or a chyliform effusion. Friends, even the illiterate, uneducated patients know what is wrong with him. Only if you listen to them. They have a knowledge. They want to tell you not only what is the matter with them, but also what matters them the most. And I think if you listen them carefully, you possibly get the clue. Don't just disregard what that illiterate patient is talking about. Friends, patient knows enough about his own problems, and you as a doctor has a medical knowledge on the top of it. If both join together, you will possibly not miss a diagnosis. That's the importance of patient listening. Friends, it doesn't take time. It just needs a commitment. It needs a dedication. It needs a concentration to what the patient is talking about. And it certainly is worth it because it ends with excellence and rationality. I hope all the time the STEER concept revolves around the thought process coming out with excellence and rationality, and I thought patient listening is the first step to start with initiating a discussion while history taking. Well, the next episode will be taken by Dr. Rajesh Chokani, and he will address us on another skill that we must develop, and the title of his talk will be History Taking is a Skill and an Art. I hope you continue to join us, and please send us your critical views on the email that has been already sent to you. Thank you very much.